Does it make you cringe? Just thinking about it makes you blush? You know what I'm talking about. Hemorrhoids, athlete's foot, erectile dysfunction, man boobs, bad breath. We've all been there. Embarrassing health problems. But today, we're going to put you on the road to recovery. Welcome to Ask Dr. Manning. Tell the truth. You had a mortifying health problem, one you ignored because you were too bashful to talk about it. Am I right? Well, today, no problem is too risque, because the truth is, embarrassing as they might be, these are real problems with real solutions. Let's go from head to toe. First up, bad breath. Sure, you can blame a garlicky meal for your halitosis, but if it's a chronic problem, your tonsils may be the culprit.
When I was talking to people in my job, and people move away when I talk to them, and I knew something wrong with my breath.
40-year-old Sadeta Velovic suffered with bad breath for 10 years, and mouthwashes and other remedies didn't help. But it turns out she had tonsil stones.
Tonsil stones, which is biofilm formed by bacteria glued together, creating a paste or stone-like structure. They locate themselves into the tonsil pockets.
Those stones cause bad breath, and each tonsil can have 10 to 20 pockets. If you have sinus problems, you are more likely to have tonsil stones. But luckily, an ear, nose, and throat specialist can remove them with a 15-minute procedure.
We use a tiny laser probe to get access to the stone or the pocket that the stone is located. The goal is to evacuate the pocket, remove part of the stone, and burn with a tiny little fiber laser the depth of the pocket so the stone will not reform and will not reattach.
Lisa Borgini also has these stones, but her problem is not bad breath.
It's just an irritating feeling. It's just very, very annoying. It's similar to as if you had something stuck in your teeth.
If left untreated, tonsil stones can cause infections. But the good news is there is little downtime after the treatment, and Sadeta is thrilled with the results.
It's worth it. I'm so happy.
Only a handful of doctors are doing this right now. It costs $2,000, but most insurance companies cover it, so get help. Well, let's face it, we all sweat. It's an essential and natural function that helps our bodies stay cool. However, for some people, it goes way beyond just a little perspiration. It's called hyperhidrosis, which causes frequent or constant excessive sweating. It usually affects the palms of the hands, soles of the feet, and underarms. It stains your clothes, but this condition can also cause social anxiety and even depression.
To take away from the embarrassment of, underarm wetness and, the odor that's associated with that as well. And, it's embarrassing when you you have these big stains under your arms, and especially, wearing white and things like that.
Fortunately for patients like Sam Fetter, there are several treatments, including Botox. Doctors use the anti-wrinkle agent to block the nerves that trigger the sweat glands. The results last for about 4 months. Here's another big ticket item, back fat. It starts with a little bulge here, a little bulge there, and can be hard to vanish. But now, thanks to advances in technology, there's a new way to get rid of those unsightly rolls.
With summer around the corner, Wendy Renoff is looking to buy some cute new tank tops, but not until she gets rid of some of those lumps and bumps.
When I'm shopping and I'm buying T-shirts and, you have that stuff in the back. You see your bra line, and you see a little bit of the fat coming on the top and a little bit of the fat coming under the bottom.
But Dr. Cheryl Karcher has a solution. She is now using a newer, thinner laser technology that is helping patients like Wendy melt away the fat.
We'll use this very fine fiber. It goes gently under the skin, and the laser light that comes out of the tip of the fiber just melts all of the fat in its way.
Though laser lipolysis has been around for the past few years, this laser has been perfected, resulting in faster results and less bruising.
Smooth lipo uses a laser that is specific for the fat cell. So it's not a laser that is absorbed by everything. It's a laser that's specifically absorbed by fat.
Smooth lipo is also less invasive than standard liposuction. This laser heats the fat, which is later sucked away, tightening the skin, giving patients a smoother look. They've also found that this technology is easier to use for those hard-to-reach spots.
Particularly for the chin area and the neck area, where we used to need to do major surgery, a chin lift or a neck lift, we can now just use this fine, smooth lipo laser fiber, melt the fat, and tighten the skin all at once. The results are fantastic.
Longer?
More recently, we've been asked to have a lot of arms done, back rolls, back fat done.
But Dr. Karcher warns this is not a weight loss procedure.
This is an isolated fat pad procedure. Certainly, after liposuction, you can gain weight and you'll get your fat dispersed all over.
That was Laura Engel reporting. For more on that procedure, you can go to smoothshapes.com or talk to your doctor. Later in the show, the medicine hunter prowls for a natural cure for pesky athlete's foot. But first, some of the most distressing problems plaguing men, man boobs, and erectile dysfunction are next. Whatever you call them, man boobs or moobs, it's a very sensitive subject for men. But fear not, there is hope.
I was in 8th grade, and I had taken my shirt off in the locker room, and one of the kids next to me who was playing sports with me, he's like, wow, it's like, you have like boobs. And then from then on, it's just tormenting.
The medical term, gynecomastia. The street term, man boobs. No man wants them and will do anything to get rid of them. But there are some hidden health factors that are associated with this condition.
Sometimes it's caused by obesity or gaining a lot of weight, and other times medications, such as prescription medications for high blood pressure or even steroid use. When you hit puberty, there's a lot of hormonal changes that sometimes kick in, and some of the boys get gynecomastia. Also, drug use can be seen in the teenage and in the 20s, such as marijuana.
Greenberg says nearly 30% of men have this condition, and according to the American Society of Plastic Surgeons, more than 14,000 boys ages 13 through 19 underwent surgery to remove this unwanted breast tissue just last year.
In general, when you're talking about gynecomastia, it's a benign situation, except the appearance of it is what bothers most people.
Something 28-year-old Ed Broderick knows all too well.
I've wanted to do this my whole life.
Liposuction the area a little bit just to flatten this down, then I'm going to take this out. We do a little liposuction in the area of the chest, followed by a small incision, at which time we remove the actual gland. The breast tissue gets removed. The whole procedure only takes about less than an hour, and patients go back to work within 48 hours and back to normal gym activity within about 3 to 4 weeks.
Patients can see an immediate difference, but results take up to a month. As for Ed, there's just one thing he can't wait to do.
I'll take my shirt off and go to the beach.
From man boobs to erectile dysfunction, it's tough for some men to talk about it. But here we go. Urologist and medical aid team member Dr. David Samadi is here to answer some questions. Hey, David, welcome. Erectile dysfunction's a big ticket item for men, especially telling their wives. How should guys approach this subject with their spouses?
It's a very sensitive topic, and I think the best way, Manny, to really talk about this is to have an open, strong communication and be honest about it. Studies after studies have shown that when you communicate openly, the anxiety is reduced, and that by itself can actually improve sexual function. Now, when couples are faced with sexual dysfunction, multiple trials have failed, multiple attempts have failed. Two phenomenon happens. There's a physical aspect of it, and then there's an emotional aspect of it.
Okay, but so give me an example. Communication says, honey, I have a problem. I feel attracted to you, but I am having difficulty getting an erection.
Well, men mostly concentrate on the physical aspect of it. They get embarrassed, they don't want to fail, so they kind of withdraw. Women take the emotional aspect of it. They feel that he's not interested or they're not attractive enough. So what can she do to make him feel better? She has to communicate. You're not alone. This can happen.
Right.
It might be the stress of job. It may be stress of work. What he can do is to make sure that she knows that he's still very attractive to her and she's a beautiful woman. And through the communication, they can solve a lot of these issues.
So now they come to you with this problem and say, Dr. Tzamati, I can't get an erection. What are some of the treatment options that you might offer?
What you really want to do is to go through a very extensive history and physical. For simple erectile function to happen, you have the whole communication of the mind and the body that has to go through. So you want to examine them, starting from the mind, find out if there's any recent anxiety-produced phenomenon. Is there a new job? Is there a loss of job? Financial crisis? Is there underlying depression or other factors that may be involved? Throwing medications on these guys are not going to really take care of the problem unless you know the underlying issue. You start coming down looking at the hormonal phenomenon. We know that as men get older, the level of testosterone is going to reduce. Testosterone has a circadian rhythm. It's high in the morning, lower in the afternoon. So you really want to make sure that if they have low libido, low interest, they're not going to get engaged in sexual activity, check the testosterone level. And finally, you want to come down and look at their medical issues. Is there high cholesterol? Hyperlipidemia? Is there high blood pressure? We know diabetes plays a huge role because diabetes affects the systemic part of the vascular arteries and the nerves. And finally, obesity. You cannot talk about diabetes without getting into obesity.
All right, so let's say, I'm going to put myself as your patient. Okay, I can't have an erection, but you do. I don't have any psychological issues. I'm, moderately healthy. Give me some of the things that you would prescribe.
What I would do, this most simple way of going about it is most oral medications. We have Viagra, Levitra, Cialis. Vasodilators bring more blood flow to the penile tissue. Cialis is a longer acting one, 36 hours. Viagra and Levitra is shorter acting ones. That's the first step. If that doesn't work, you go on to something called a vacuum pump. It's a more mechanical way of doing it, but it's a tube that goes over the penis, causes a vacuum, brings the blood flow to
That really works?
Well,
I've seen that in some magazines, David.
It can work, but it's a little mechanical. It's not very spontaneous, and the compliance rate is very low. If that doesn't work, you move on to things like suppository. There's a company called Muse, which is placing small pellets in the urethra. And that's another way of getting a local vasodilation. And if all fails, if you go through the whole system, then you have the penile implants. And nowadays, they're safe. It's done through ambulatory process. Patients can go home the same day, and it works really well.
All right. Well, we have an email for you because you are the world expert on this subject. And the email reads, I am almost 25 years old, and I'm having a problem with premature ejaculation. I always have. I only last about 2 to 5 minutes. Is there anything I can do?
It's usually seen in younger guys. It's more common than it's thought. Almost 30% of younger men have premature ejaculation, and a lot of it has to do with psychological. There's no mechanical. This is not the old man disease where they have.
So they're like super excited.
They have performance anxiety. They're not comfortable with the control of their ejaculations. They may not be experienced enough. And, the technique of the squeeze technique, stop and squeezing the tip of the penis, which takes the sensation away, is the easiest way to deal with this. But mostly we know that on hormonal level, things like serotonin can delay ejaculations. So the easiest way to deal with these kind of patients is give them antidepressant medications like Zoloft, like Prozac, that would increase the level of serotonin and can delay the ejaculation. This is a temporary medication until they get a real experience and comfortable with the partner. We see this a lot of times when a young man is in a relationship who is not really comfortable with a partner, and that's when it usually happens. But with time, that experience will help them.
Well, there's your answer. David, thank you for coming to the program. Coming up, some people would rather live in pain because of hemorrhoids than bring it up at their doctors. So later in the show, we'll have a cure for you. Up next.
When I sneezed, I always passed a little urine. When I laughed a lot, same thing. If I jumped around.
Urinary incontinence is something more than 13 million Americans struggle with every day. We'll tackle that tough topic when we come back. We have dealt with some of the most troubling conditions affecting men. Now, ladies, it's your turn. This next health issue is not something women take lightly. Urinary incontinence is a common and debilitating problem. I spoke with a leading urologist who uses a minimally invasive procedure that is giving women their lives back.
It's just got to be very annoying, frustrating.
For 67-year-old Connie Gomez, life became really frustrating about 5 years ago when she started experiencing symptoms of incontinence.
When I sneezed, I always passed a little urine. When I laughed a lot, same thing. If I jumped around.
And Connie is not alone. More than 13 million Americans struggle with this embarrassing condition. I stopped by Dr. Deborah Fromer's office to talk about why this happens.
How do I tell the difference if I have a problem or I just have an accident?
Incontinence is not a normal part of life. It's not a normal part of aging. Incontinence is a disease. It's an illness that can really debilitate some people.
Dr. Fromer says the most common cause of incontinence is pregnancy and delivery. But fortunately for mothers like Connie, Dr. Fromer is able to transform their lives with a simple procedure.
What we do is we put a little strip of mesh, the same kind of mesh that we use in hernia repairs, underneath the urethra, between the vagina and the urethra.
The minimally invasive surgery is done through a small incision in the vagina. Complications are extremely rare, with most patients only complaining of leg pain for a few days. 45-year-old Maureen Bruno had the sling procedure done 2 years ago.
You can cough and laugh and not have to worry about holding your legs, or, I recommend it highly.
Connie couldn't agree more.
It's so easy to take care of it, and you don't have to be frustrated or uncomfortable or wear pads and things like that. I would definitely recommend having it done.
As Dr. Fromer said, incontinence is not normal. It's a disease that can have an extreme impact on your everyday life. So ladies, make sure you talk to your doctor if you're experiencing symptoms. And our next guest is also in the business of giving women their groove back. She's a clinical associate professor of gynecology at Weill Cornell Medical Center, the founder of a very unique spa called FIT, specializing in pelvic floor health for women, and the author of a new book called Plumbing and Renovations. Dr. Lori Romanzi, thanks for being here. Lori, thank you.
Thank you.
Plumbing and Renovations.
Yep.
Yeah, good title for a book. This is
think
what you
so.
do.
This is what I do.
You give women the groove back, man.
That's right.
I'm talking about embarrassing health questions that people usually don't like to talk to their doctors about, and this is right up your alley. Give me, what is the most embarrassing health problem that a patient comes to you for?
It's all embarrassing.
Just
It
give
is
me
not
one
fun. Let's
or
see.
two.
Incontinence in the middle of yoga class. Yeah, that's a big one.
All right, so they
Certain
pee in their pants
yoga
while doing yoga.
positions, right? Can't control gas during exercise class. Embarrassment during sex.
What about prolapse? That's a big ticket item.
Right. Prolapse is it's a very isolating condition for a lot of women. When things start to fall out of place and you've got bulges at the vaginal opening and everything's out of position, it can be a real turnoff for the woman herself, how she feels about herself and her body image, and it can make her reluctant to have sex.
Because a lot of times, I guess after women have 1 or 2 children, the uterus kind of falls into the vaginal canal, and sometimes sometimes they feel it, and they get scared.
Right. Well, let's put it this way.
Yeah.
Of all the things that happen to the female pelvis, childbirth is by far the biggest challenge. And I want to go on record as saying many women can have multiple children with minimal changes to vaginal contour and tone. But for a lot of women, they're never quite the same in a fashion that is truly bothersome to them.
Right. the other big ticket item is, I guess, the what do you would call it, vaginal laxity? Or
vaginal laxity, vaginal tone, vaginal contour, snugness.
How common is that? Or do really people come to you for that?
They do all the time. You know, every time a baby is born, the perineum, which is the connective tissue between the vagina and the rectum, takes a little bit of a toll. For a lot of women in the remodeling phase after childbirth, that'll go back to normal or close enough to normal that they don't notice a difference. But for a significant portion of women, the tone is never restored. So they feel loose all the time.
So how do you fix it?
It's called a perineoplasty. Also, vaginoplasty.
So this is a surgical thing?
It's a surgical thing.
So what do you take, the extra tissue?
It's a minor surgical procedure. Actually, what you need to do is, because those connective tissues were pulled to the side under the skin, you just need to make a small incision, go to the side, bring those tissues back together in the center, knit them back together literally with stitches, reconnect them to the tissues above it so that they're in contact with the Kegel muscles. And then when a woman kegels and closes her vagina, she can close her vagina. She has control again.
I got an email for you because a viewer knew you were coming, and she sent in an email. And it says, after my second child was born, I feel like if the vagina is loose because I can't feel much, and she can't reach a climax. So she has sexual issues. Kegel exercises are not helping, so she wants to try something that is not surgical. Here's the trick, non-surgical. What do you think?
Well, if she's doing Kegel exercises on her own, she might want to go in for proper pelvic floor
and Kegel exercises is basically trying to bring your vaginal muscles together, right?
Right. Very simply, you're closing the vagina. You're closing the vagina and anus together. It's all one big muscle group that runs on the sides of the pelvis.
And how often do you do that? You do that every day, like a routine exercise?
I think all women should make it a habit, which is, again, why I opened the spa for Kegel exercises. But I think all women should make it a habit, and usually a couple dozen a day is plenty, where you close the area for a count of 5 repeatedly 10 times in a row, and then some quick ones where you're just contracting and relaxing maybe 20 or 30 times in a row every single day.
Okay, but that's not working too well for her.
Right. If that's not working for her, then she might want to go to the next level where you work with biofeedback. You put a sensor in the vagina and you do the Kegels around the sensor, and you're looking at a video screen. I call it vaginal video games. You literally can make butterflies fly and puppets jump and cars race and all sorts of things.
You're telling me the truth.
I am not joking.
Okay, and I guess that helps a lot too.
Right, because a lot of women are they'll have difficulty isolating the muscles, and by using biofeedback, which you're trying to make things happen on a screen, it can make Kegel exercises much more efficient. There's also pelvic floor electric stimulation, very similar to what happens if anyone's ever rehabbed a knee and they put the patches on and do the electric stim.
So there's stuff to.
There's things to do.
Well, Dr. Romanzi, as always, you are the queen bee when it comes to bringing the groove back. And your book, of course, Plumbing and Renovation, you can get it in all bookstores. Thank you so much.
Thank you very much, Manny. Good to see you again.
Coming up later, there are small, grainy, and fleshy bumps, warts. But first, let's take a look inside nature's medicine cabinet with the Medicine Hunter.
Sometimes people get athlete's foot. You go to a gym, you go to a place, you get itchy feet, you want to get rid of it, it's red, it's irritating. Kava, which comes from the South Pacific, is used to make a relaxing beverage. What does that have to do with athlete's foot? You can also make a tea out of this, or a bath. This is a root from a plant in the pepper family. That's kava, all right. You put this on athlete's foot, and we know it works. It actually helps to get rid of it. So if you've got that problem, if your feet itch, get yourself to an herb store, get some kava, make some tea, bathe your feet in it, get rid of that athlete's foot.
Welcome back. We're working our way down the body, talking through some of the most mortifying health problems. Next, the touchy subject of hemorrhoids. About 10 million people suffer from this condition. It happens when the veins inside the body become swollen. Symptoms include itching, burning, and bleeding, and just about anyone can get them. It's more common in men over 30 and in postpartum women. 60-year-old Richard Alfao has been dealing with this problem for 15 years. He tried over-the-counter remedies, but nothing worked until he visited the Hemorrhoid Relief Center, which uses a non-surgical solution.
It's almost like an unbelievable toothache in a different area.
The one advantage that infrared coagulation has shown through the years, again, and it's been around for 30 years now, is that it doesn't have the risks and complications associated with any of the other treatments.
A small probe is placed at the base of the hemorrhoid. The doctor then uses an infrared light on the exposed tissue. This coagulates the vein above the hemorrhoid and it causes it to shrink and recede. The 10-minute procedure is virtually painless, doesn't require anesthesia, and is covered by most insurance carriers. You will need about 4 to 7 treatments. And Richard says he feels as good as new. For more information, log on to hemorrhoidcenters.com. They are ugly and unsightly, but the good news is warts are usually harmless. Common warts are non-cancerous skin growths caused by the human papillomavirus. They can grow on the hands or fingers and sometimes even on the feet. Warts often disappear on their own, but for patients like Brian Corner, they can be difficult to ditch. He tried over-the-counter medications, but his warts would always come back until he tried a new technology that promises to zap them away for good.
They're just unsightly. They're not, not something I want to, touch my kids with my warty hands and stuff like that.
I think laser is very useful and very quick. You just treat once and you get over 80% success rate on average. It basically destroys the skin with the tissue and the virus.
In seconds, the laser eliminates the blood supply to the wart without creating a wound, and the wart dries up. If you have multiple warts, you might need more than one session. And we are finally down to the feet. This next health issue ranks right up there as one of the worst. Toenail fungus happens when athlete's foot invades the nail bed. Dr. Suzanne Levine, a leading foot surgeon in New York City, sees it all the time and says there are ways to avoid it, including keeping your feet as dry as possible, bringing your own instruments when you get a pedicure, and most importantly, wearing flip-flops when you use public showers in places like the gym.
Public spas, showers, health clubs, yoga steam rooms, especially the steam yoga, a wonderful breeding ground for fungus. And once it invades the nail bed, we're talking about a difficult treatment.
Dr. Levine prefers topical treatments over oral medication. She says it's a little more tedious, but well worth the results. We started with the head today, so I want to come back to the old melon and give you something to think about. On average, you only get about 7 minutes of face time with your doctor, so make every second count. There is very little you can say that will make your doctor cringe. We have heard it all, believe you me. So be straightforward, because we're here to help you. And nothing, and I mean nothing, is too embarrassing when it comes to your health. So speak up about what ails you and get better. Remember to check out FoxNewsHealth.com for more on today's topic. That's all for now. Thank you so much for joining us. I'm Dr. Manny, and I'll see you next week.